Hafre, guys, and welcome to another episode of the One Micronesia Podcast. And in this episode, I have three beautiful ladies with me here who are super busy ladies, but took the time out of their busy schedule to join me here on the podcast to talk about what's been going around. And we all know it's COVID testings left and right. We'll get into details about what the plans are, and I love this. This task force, but I'm going to call it a task force because I love how the government of Guam have come together, teamed up with the FSM consulate office and our people, our FAS citizens here in Guam to help out with, especially with on how to stop the spread of COVID-19 in our community. So here with me today, I do have Grace Bordallo from the Public Health. I also have the Consul General, the FSM Consul General, Teresa Filepin, and Nadine Songeni from the Guahan Humanities. So thank you guys so much for joining me on the podcast today.
Nice to be with you.
Thank you, Vic. Yeah, nice to be here.
Thank you guys so much. So I guess we'll just jump right into it. I know you guys are busy, so I guess we'll talk about the COVID results, what we know so far. I know that's how all of this started because we figured out that we saw all these cases pop up, and we saw our citizens from the FAS were amongst those numbers that were popping up the last 2 weeks. So let's talk about some of those numbers before we get into the testings.
Sure. Hi. So unfortunately, we have seen 80 deaths so far, COVID-related deaths, from March till recently. We have 4,812 confirmed cases. What we're seeing, and this is all in our situation report at dphss.guam.gov on our department's website, is that there's community spread, and it's spread right now we're seeing it's through household contact. About 1,300 cases have been found through household contact. And we know that wearing a mask works. Absent of a vaccine, we continue to educate our community through wearing a mask, being socially distant from each other, avoiding crowds, avoiding going outside the house if you're sick, and taking a test if you feel symptoms, calling 311 or medical triage. If you feel like you have symptoms and you just need some medical advice, we have a nurse triage that's available Monday through Sunday, and 311 option 1 or 311, and we can connect you to various assistants.
Thank you so much, Grace. So I guess that brings us to the next part here, which talks about the first week of testings. I know you guys did a whole weekend of testings. So let's talk about that. How did that go? What was the outcome, the turnout?
So working with the FSM Council, we've identified certain neighborhoods in the northern part of Guam, and we did door-to-door testing. The first day was just canvassing out and giving educational literature and letting the community know what we were going to do. And then the second day through the weekend, we went door-to-door to families, and we did the nasopharyngeal swabbing, and we found quite a number of confirmed positive cases. And so this weekend will be our second round of going door to door at our targeted population areas.
Actually, this weekend it's not a door to door. We've designated
that's right.
we've designated an area, the Astambo Middle School gym. And we're registering people right now. The target is FSM residents to register through the consulate office or through our Facebook page, FSM Association of Guam, a Facebook page, to register. So the target is 200 people to get tested. It's free testing, collaboration with Department of Public Health and Social Services. And this is, of course, an endorsement by the government, by the Honorable Governor Lulian Guerrero and the FSM Association of Guam and the Consulate Office, a combined effort to reach out into the affected communities. I've been saying this, and it cannot be overemphasized, that this virus it's a non-ethnic matter. So ethnicity should not be an issue here, but we're taking a more aggressive approach and reaching out to our community because we're very concerned. The number of confirmed cases keep rising, is on the rise, and we want to make sure that resources are available to our community so that they get the best out of, be able to deal with this virus as best as possible, and with the appropriate resources that are available. So it's a combined effort, and we're very thankful for public health for with this outreach to the community and providing the free resources in terms of the test and samplings. So the first one was early back in last month. We had it at the Zigo Gym, and then this next one is coming up on this November 7th. So, this is an appeal to our community. Please come out, get tested, register with us, get tested. It's not only for your peace of mind, where you are, the results of this virus, but also for those that you're interacting with and are encountering. And if you unfortunately test positive, there are also resources available that may help with your situation in terms of if you're going to have to miss work because you're positive, unemployment, you're eligible for unemployment. So information are available through the office and the Association of Guam Web Facebook page. So please reach out to us. If we don't have the answers to your questions, we will find the answers. We will get to the right department, such as public health and other resources that are available to help us. So again, this is an appeal to everybody. There's a lot of myths, a lot of concerns going around right now, especially related to this virus. Prayers are always, because welcome. But that doesn't mean that we'll, stay immune to the virus. Even local medicine, local herbs. I know some folks from our islands are, diligently taking the local medicine. But again, it does not prevent getting the virus. It does not mean that you're immune to the virus. Practicing social distancing, and as Grace mentioned, stay home. If you don't need to go out, wear your masks, sanitize. All of these things that the health experts have been putting out there are preventative measures that each and every one of us need to practice so that we can get a hold or contain the continuous widespread of this virus.
Okay, thank you so much, CG. I'm going to go back to Grace. Grace, I want to just so you can throw out there, how was the turnout though at the first weekend when you guys were out there? Were there a lot of people came out, or did you guys see a low number? How was the turnout?
At the Jigo Gym, are you talking about the Jigo Gym? Mm-hmm. So we actually have a cap, and we ask people to pre-register. I don't think we met the 200, and there's various reasons. I mean, people could have car problems, or people may have been sick. But we need to cap it at 200 so that we also don't overwhelm our healthcare nurses who do need breaks and need to eat lunch and while we do testing at the gym, we also take specimens from the different labs. So our Guam Public Health Laboratory, does all the testing. So we did not want to have a turnout like what happened in August when our lab was overwhelmed, but it was a good amount. I mean, this was done at a very somewhat last minute. So
right.
So the turnout was okay.
That's cool. I'm gonna go to Nadine real quick, and I know Nadine, Humanities Guahan. Like I said, I know I did a podcast with you guys. You do so much with the community, and also including our FAS community. Let's. What part do you guys have in this awesome collaboration?
Yeah, so with us at Humanities Guahan, we have our programs, our educational, cultural, and humanities-based programming. Where I fit into this puzzle is trying to bridge programs that we facilitate or coordinate with the FSM or FAS communities on Guam. So in this particular outreach, it was more so that I could assist with promotions and marketing and logistics. And then from this partnership, the people that we would encounter or reach out to would be people that I would love to further assist through these programs that we provide at Humanities Guahan. But something that we always believe in, and it's very easily seen through this endeavor that we're having at the FSM Association, is the grassroots collaboration, and that's where you really see the strength in the collaboration with the various FSM leadership, at the community leaders, community advocates, church leaders, and this is where it's both a challenge and a strength, because there's our beautiful islands in Micronesia is so vast, and so there's so many people to try to reach out to, but the ones so far that we've been able to so to speak, what do you call it? Add to our canoe of trying to get everyone safely tested and know what options there are. It's been a rewarding experience, but also something that we know that we have to keep working on. And we really want to just make sure that everyone knows that the association really exists of these various community volunteers to really help bridge whatever challenges or gaps there are that exist for FSM citizens on Guam. So this is more kind of me playing two parts to help with outreach, but also those outreach would then be able to get other resources from Humanities Guahan, the Micronesian Resource Center, all other important nonprofit organizations.
All right. Thank you so much, Nadine. And I think my next question here, I think I'll throw it to CG and Grace for the public health. Now, one of the big words that was used uh, 2 weeks ago was this word called multi-generational homes. So for the people who don't know, can you guys talk more about what is a multi-generational home?
Actually, we've known that when you're in a closed setting, especially in a community island like Guam or in the other Pacific Islands, the grandmothers help take care of their grandchildren, great grandparents help take care of their great grandchildren. So you have multiple generations living in one household. So we early on in the pandemic, the public health emergency was declared um, on March 14, and the CDC was putting out information on non-pharmaceutical preventative measures. And one of the preventative measures is being aware of how to protect yourself in a multi-generational household. That means it's really difficult if you only have so many bedrooms, so many bathrooms. And if one person has the virus and this virus kills, you really need to continue to wash your hands frequently. Don't touch your face with unwashed hands. Clean and disinfect. That means sanitize with alcohol frequently touched areas. When we have a multi-generational household, it's very challenging to protect each other because we want to take out the mask, and we don't know whether someone has the virus, because the virus can affect people in different ways, like being asymptomatic. You have the virus, but you don't know you have it. So even in the household, we have to be careful about how we interact with each other. And we just need to be aware, like our cultural norms of like kissing each other on the cheek or taking the hand and paying respect to our elders. We have to recognize what we do in order to prevent the transmission. Like, don't share eating utensils, don't share common food, dishes, um, eat separately. So in this situation, unfortunately, and that's why it's a pandemic. It's more than just Guam. Other countries have multiple generational households. So this virus, unfortunately, sadly, has killed millions of people already. And for ourselves, we need to take personal responsibility and just be aware of our actions so that we don't um, transmit or contract the virus from the workplace or just buying, going out and about, getting our necessary food items or medicines or whatever it is that we need to do outside of our home, and then being careful when we're with our loved ones and with our friends and coworkers.
Okay. And my next question would be, let's say somebody got in contact with the virus and they need to, because then now they need to go into quarantine. And I've heard stories of families who fortunate enough to have separate spaces in their household where they can put that person in there to wait out for the 14 days. But for some of the households that we have here on Guam, there are more than 10 people in the household. Is there a way that we that you guys have talked about it, if there was a situation or a case like that? What if they don't have a space? What if there are 10 people in the household and there was only 2 bedrooms? Is there a way that the government and the consul general have talked or made a deal on how to take care of those people, maybe put them somewhere? Has there been a talk like that?
What the public health does is, once the results come out and and a person is tested positive, they assess the living condition or the living situation. And if, for example, what you were just saying, they don't have the space to self-isolate or home quarantine, then they will move them to the government quarantine facility. So there is no deal. This is what the government is doing. Any travelers coming in, they're putting them into quarantine. And when the home situation does not allow for home isolation, where everybody is kept safe, then that person will be moved to the government quarantine facility until they're all in the clear, or they've been informed by public health that they're fully recovered, and then they can go back to their homes.
Okay, that's awesome.
Yeah, so if I can just add to that, we do have our isolation facility for those who cannot isolate at home. Maybe they have elderly relatives living at home and they don't want to infect their elderly relatives. So we do have an isolation facility, and our quarantine facility is actually for our travelers coming into Guam. So if you're a close contact, then and you're at home and it's not travel related, then we do ask that you quarantine at home. And that means you don't go out, you don't leave your house unless you're getting essential provisions like food. But even at that, we just ask that you don't go out.
And that's one thing too that I want to touch on is the home isolation. And you said it, when you're told to stay home for X number of days, that means stay home and not go out. Now, some people haven't been paying attention or been listening to those requirements, and that's where we're putting other people's lives at stake too, because we're positive and we're not listening, we're not complying with the requirements, and we still go out in public because we have what we deem essential activities that we need to leave our houses for. So and it's affecting other people that you encounter when you leave the safety of your house and you go out into public. So it is another appeal to everybody when public health tells you certain, to limit certain actions or activities, or put a stop to it until you're all in the clear, then let's please listen and comply, because it's really for our own safety and for the safety of everybody that we're coming in contact with. When you're on home isolation, you're not in the clear until public health says so. Is that correct, Grace?
That is correct. And it really gets complicated because you could have someone in isolation. That means they're confirmed positive and they're in their bedroom and isolating. And then the family is kind of like bringing them food at the doorway and then washing hands and just being very careful. And that means that the family or the household that lives with that isolated case, they're in quarantine. They have to quarantine in a bubble. And if another person gets the the virus, then that means there's another person that has to be in isolation. So even though there's other people that may be in quarantine, it's like, okay, that's 14 days. Well, no, now there's another positive. So the timeline, it changes and it shifts. It depends on when was the last exposure or symptoms. So if they have any questions, they can call our medical triage and talk with our nurses. Our lead case investigator, our case investigators at Public Health will call the confirmed positive cases and do the assessment if they can isolate properly at home and give guidance on when they can be cleared, because the timeline does shift with each member who may become positive.
I have another question for you, Grace. If, for example, a household have tested positive, or one person has tested positive, and they're being told to home isolate. Now, how often does public health reach out to this household and find out how they're doing, or even after the mandated 14 days, and then they're in the clear, do they get another test? What's the procedure on that, or public health's role in ensuring that these people are staying put, their conditions are improving or whatnot?
So we're all in this together. So hopefully by now people know that if you are a confirmed case, then you really need to stay put. And the CDC, I think a month or two ago, said that you don't need to retest to see if you're negative, because it has shown that remnants of the virus stay in you. But if you don't have symptoms, and your symptoms have resolved itself without medicine, without acetaminophen or Tylenol, then it's like 10 days after your symptoms, then you should be okay. And then public health will give you a clearance letter. Public health, our numbers are overwhelming. I think on our situation report, we said we had more than 1,500 people in active isolation. It's a challenge for us. I believe we did used to monitor twice a day, and now we're just trying to put guidance, having meetings with the community and with a leadership like you, Consul General, or through the media like you, Victorious, and getting the information that if you are and information to our clinics that if you are a confirmed positive case, then stay home, monitor yourself, reach out to our medical triage nurses at 311 option 1, and there's 11 cell phone numbers that are public as well. And we will try to reach out to you, and we do reach out to people, but again, with 1,500 cases, and there's not a lot of staff, we do try our best. If people need to reach out to us, we have a medical triage number, we have a joint information center, and people call 311 option 8, also looking for guidance.
Right. Well, the reason why I brought that up is, I'm hearing of, of families that don't hear back from public health after the 5th day, and they say, oh, that probably means that we're good. We can go about and do, continue to doing what we normally do, just because they haven't heard back from public health. So the assumption is that they're okay. That's why public health is not constantly calling them and checking up on them. But they haven't gotten that clearance letter yet. So they should really, so your advice is wait until you get that clearance letter that you're okay.
Yeah, I mean, and monitor your symptoms. It's what the CDC guidance does say. It's 10 days after symptoms resolve itself naturally, then you're almost going to be in the clear, but you have to watch out and monitor the other people in your household, because if someone has symptoms, someone's positive and they take a test, then you're really going to need to stay in quarantine and you're not cleared. I received a call the other day of someone who received a clearance letter, and they just wanted to make sure they were cleared. And I'm glad he
Right.
called, and that person really wasn't cleared because he had a household member who was confirmed.
Right.
So that person may have resolved her case, but now there's a household member that was confirmed, and so that they need to get guidance from public health, and they should reach out to our medical triage or joint information center. But for those who do have issues like social service issues, we can help and try and get services for those families because they're isolating. They don't know how they're going to get certain medicines or certain whatever needs that need to be met because they only have family that can help them. So they should reach out to us and we'll see what we can do.
Okay.
Those are wraparound services.
Victoria should be the one asking the questions, but here I am.
No, thank you. It's okay. That's good because I honestly you added those to my question. I was like, oh, I should have asked that. Good. Thank you so much, CG. I guess we'll move on to what we're doing now and for the future. We'll talk about this weekend's testing. Now, how do people sign up? And I know people signed up for last week because it was supposed to be for last week, but it was
yes.
So let's talk about more about that.
So for those that signed up last week and we had to postpone because of the weather was predicted to be a little bit worse than what happened on Saturday, which was a very, very perfect day. But anyways, the test was postponed. So those that registered last week were moved. They're still on the registry. We're calling them to confirm if they're gonna come out this weekend. And we're adding more people. So there's, like I said at the beginning, they're called the FSM Consulate Office 646-9154, or go to the FSM Association of Guam Facebook page, or just if you know any FSM Association members, just send them a message so that we can register you. We're targeting 200 people for this weekend. Rather than have resources go to waste, with not enough people showing up, we're really encouraging people, if you sign up, please free up your schedule so that you can come get tested. It's for yourself, for your family, your loved ones. And it's, the experts are telling us the only way to be able to continue doing what we can, with the new normal, go get tested. Please go get tested. If you're not able to reach us, through the telephone, just send us a Facebook Messenger and we'll register you. And this is going to be at the Istanbul Middle School gym, and it's going to be from 9 to 12 p.m. 9 a.m. in the morning to 12 p.m. So please come out, register, and then go get tested.
Okay, thank you so much.
We do ask that there be only 4 people per vehicle,
vehicle.
that it's just more safe for our nurses who have to reach in and do the nasopharyngeal swab.
Okay. All right. So that's this weekend. And then are there more plans for other testings to be done, or we'll just see after the data that comes out this weekend?
The work with public health is not over yet. This pandemic, it's affecting all aspects of our lives these days. So it's not over. The work is, far from over. What we're doing right now is we're, going about this gradually and seeing how, what the results are. The discussion or the conversation with public health still is, after this one, then we'll explore the door-to-door again, or maybe target, pockets in the community that we see a rise in confirmed cases. So it's still ongoing. This one has been, it's definite. We have some dates right now, so this is the one that we're going with. But after this, then if we'll be making more announcements on future testing, activities.
Okay. All right. Thank you. And again, if people need to know more information, where can they go to find all these information?
Regarding situation report, of course, public health website. There's also, they have a dashboard. Information about COVID and that statistics and everything can also be found on Facebook, FSM Association of Guam web Facebook page, and even call the office 646-9154.